Hi, my name is Dr. Erica Connors, and I am the Executive Director for World. Here at World, we provide a host of services ranging from our monthly fresh food market, which is free the third Wednesday of every month. We provide HIV testing here on site and in the community. We also do outreach for both PrEP, HIV and Hep C prevention, COVID vaccinations, and a host of other things. Today, my colleague Leslie Ariola and I will be presenting to you substance use and PTSD. We will be discussing the definition of them, their relationship, as well as prevalence, and some strategies to address it. 1 in 11 adults in the United States are diagnosed with PTSD. In addition to that, during their lifetime, youth ages 13 to 18, 8% of them in the United States will experience PTSD. The three ethnic groups that have a higher rate of PTSD are African Americans, Latinos, Native Americans, and natives of Alaska. PTSD starts by having exposure to a traumatic event or seeing repeatedly events that are traumatic. What then happens is when one experiences these traumatic events, the next step is how do we cope with that event? So for some, those experiences are managed in a healthy way. Some may talk about it, some may seek outside help, such as therapy. And then there is a maladaptive way to manage it. And that, of course, is introducing the use of substances. What makes PTSD so significant is that an event happens, we experience that event, then we have to manage it. What is involved in PTSD is our arousal. When we experience trauma, our arousal, which is fueled by our amygdala, which is here in the brain, our emotion center, goes into overdrive for fear. When that happens, we then have to figure out, okay, what do I do now? The event is over, but I'm left with all of these emotions and thoughts about what happened to me or what I saw. And a traumatic event can be something as difficult as being sexually abused or molested, being physically assaulted, or viewing those types of things. Other types of trauma could just be simply watching the news and hearing about all of the negativity that's happening in the world or in one's community.
Hi, my name is Leslie Aviola, and I am the Prevention Navigator here at World. World is a SAMHSA grant-funded program, which includes substance misuse and HIV and Hep C prevention education, as well as partnering with community organizations and providing navigation services to our clients. World implements Seeking Safety, which is a evidence-based service. This is used to address substance use, PTSD, HIV, and Hep C prevention and education.
Seeking Safety is a treatment intervention for people with a history of PTSD and substance use. The priority population includes anyone with a history of trauma and/or addiction, anyone who can benefit from new coping skills, for example, people who have family members with addiction, people who report unsafe behavior, including risky substance use, self-harm, and poor self-care, and adults and adolescents of any gender or background. Now going into the principles of seeking safety. Safety is the goal. There are 25 topics total. These topics can be done in any order and in different formats, including group or individual. Trauma and addiction are addressed at the same time, and since they often reinforce each other, it is more helpful to treat them simultaneously. Seeking safety is meant to be optimistic, empowering, and engaging. It is a focus on ideals and that there is hope for the future. It also provides attention to providers, recognizing their emotional reaction to clients and engaging in self-care. There are 4 content domains in Seeking Safety, the first one being behavioral, which is to commit to action. Clients make a commitment of one concrete step to promote healing. The second one is cognitive. This is a shift towards self-respect and adaptation. Clients are able to explore the meaning of substances in context to their PTSD. Is it self-medication, slow suicide, or things like that? Third is interpersonal. This is to maximize the presence of supportive people in their life and let go of destructive people. Because regardless of the type of trauma, it may cause survivor distrust of other people and also confusion on what is expected in a relationship. The fourth content domain is case management. This is a holistic approach which is needed in order for psychological interventions to work. Each participant will identify what safety means to them, whether that's discontinuing substance abuse, letting go of dangerous relationships, reducing HIV risk, reducing self-harm, attaining self-care, coping safely, or regaining control of life. Why seeking safety for world? Many of our clients and members have traumatic histories. The flexibility allows us to adjust to each client's need.
So let's talk a little bit about the Seeking Safety program. And I noticed, or we've mentioned earlier, we've talked about PTSD, we've talked about how substance use is connected to PTSD. And many people who have PTSD are often later diagnosed with a substance use disorder of some sort. And that is because it is by design when people start folding in the use of substances to manage their trauma, it's really a way to kind of check out and be disconnected from the intrusive thoughts or negative emotions or even dramatic changes in their arousal and reactivity to things such as someone touching them or a sound or a smell of some sort. What are some of the either kind of topics that Seeking Safety looks at?
So some of the topics that are included in Seeking Safety include asking for help, knowing what a healthy relationship is, things like commitment, honesty. It's a range of 25 different topics, and they can all be applied depending on what the client needs.
And how could Seeking Safety be useful in addressing trauma or PTSD?
So Seeking Safety addresses both substance use and PTSD because most of the time they coexist together. And by addressing both of them, it's more successful. It has been seen to be more successful than addressing each individually.
And is it kind of free flowing where people are just like, here's my trauma? Or is there structure to it? Kind of how does that work?
Seeking Safety has more of a structure implemented. It starts with a check-in to see how the client is doing, and then it moves into the content depending on what the topic is that day, based on the client's need, and then there's a checkout portion to it.
And you mentioned that Seeking Safety can happen in different formats, individually as well as in a group. And it can be for adolescents, it can be for adults. With a tool that has that much of a variety, would you say that it's a tool that's really for anyone that's experiencing PTSD?
Seeking Safety, the good thing about Seeking Safety is that it can be applied to multiple different populations. It doesn't have one specific population that it needs to be. There's no required criteria to be able to
use it or benefit from it?
Yes.
Okay. Is there anything in particular that you would say is different about people who have PTSD versus people who don't? Like, what's the difference between someone who has experienced trauma and somebody who hasn't, as far as kind of maybe how they see things or do things?
So PTSD can have a big impact daily on a person's life. I think one of the things that differentiates people is knowing how to deal or how to express and talk about that PTSD. If people have that space to talk about it,
Mhm.
and feel comfortable, which Seeking Safety provides, they're able to learn and apply the skills that Seeking Safety provides.
And I think what I like just about what you're saying is that when someone experiences trauma, they actually feel unsafe. And so, in feeling unsafe, you provide a program that actually creates a space of safety where difficult topics can be discussed, or maybe they don't even have to talk about their trauma, but they can just talk about how it has affected them. Would you say that that's fairly accurate?
Yeah, and then they also provide different coping examples
Mhm.
and ways to deal with the PTSD and substance use.
I like it. I think I'm pro Seeking Safety.